The liver is a vital organ that often works silently behind the scenes, but when it struggles, problems can arise quietly. Let's explore its key functions that keep our bodies healthy. One key function is filtering blood. One key function is producing bile. One key function is storing energy. One key function is detoxification. These functions highlight how essential the liver is to our health. However, liver problems can manifest subtly, making early detection crucial. Jaundice is a key sign of liver problems that you can see with your own eyes. Jaundice appears as a yellowing of the skin and the whites of the eyes. Jaundice occurs when the liver cannot properly process bilirubin, a yellow pigment produced from the breakdown of red blood cells. Here are visual examples showing the difference between normal appearance and jaundice. Abdominal pain and swelling are key signs that your liver may be struggling. Liver-related abdominal pain often occurs in the upper right quadrant of the abdomen, where the liver is located. This pain can range from a dull ache to sharp discomfort and may worsen after eating fatty foods or drinking alcohol. It's caused by the liver's enlargement pressing against surrounding tissues. Another sign is ascites, which is the abnormal accumulation of fluid in the abdominal cavity. This can cause abdominal swelling and discomfort. Ascites is primarily caused by two liver-related issues. First, portal hypertension occurs when blood pressure rises in the veins that carry blood to the liver, causing fluid to leak out. Second, reduced production of albumin, a protein made by the liver, allows fluid to escape from blood vessels into the abdominal space. Dark urine, especially when it appears brown or tea-colored, can be a warning sign from your liver. This discoloration often indicates elevated bilirubin levels, a substance processed by the liver. While dehydration can also make urine appear darker, persistent dark urine despite adequate hydration may point to liver problems that need medical attention. Sign number 5 of liver problems is pale stool. Normal stool gets its brown color from bile produced by the liver. Normal stool gets its brown color from bile, a digestive fluid produced by the liver that helps break down fats. The liver produces bile, which flows through ducts into the intestines, where it gives stool its characteristic brown color. If the liver isn't producing or releasing enough bile, stool can appear pale, clay-colored, or grayish instead of brown. This pale appearance indicates a potential blockage in the bile ducts or an underlying liver problem that prevents bile from reaching the intestines. Persistent itching of the skin, known medically as pruritus, can be an important warning sign of liver disease, even when no visible rash is present. This type of itching differs from common causes like dry skin or allergies because it persists despite typical treatments. The liver normally processes bile salts, but when liver function is impaired, these substances can build up in the bloodstream and deposit in the skin, triggering persistent itching. This is different from occasional itching caused by dry skin or allergies, which typically improves with moisturizers or antihistamines. Liver-related itching often continues despite these treatments. The liver plays a crucial role in producing clotting factors, proteins that help blood clot and stop bleeding. When the liver is damaged, it cannot produce enough of these clotting factors, leading to easy bruising, nosebleeds, or prolonged bleeding from cuts. The liver synthesizes several clotting factors, including factors 2, 7, 9, and X. These proteins work together to form blood clots when injury occurs, preventing excessive blood loss. When liver damage occurs, the production of these clotting factors decreases significantly. This impairment reduces the body's ability to form proper blood clots. As a result, individuals may experience easy bruising, frequent nosebleeds, or prolonged bleeding from minor cuts and injuries. This issue is also connected to impaired vitamin K absorption. The liver produces bile, which helps absorb vitamin K from food. Liver damage can reduce bile production, leading to vitamin K deficiency and further worsening clotting problems. Nausea and vomiting can sometimes indicate liver distress, though these symptoms are not specific to liver problems and may occur with many other conditions. They become more significant when they appear together with other symptoms associated with liver health. Loss of appetite is another potential sign that your liver may be struggling. This symptom often accompanies nausea and abdominal discomfort, signaling that your digestive system is being affected by liver issues. Swollen ankles and feet, known as edema, can be a sign of liver problems. This occurs when the liver's reduced ability to produce albumin leads to fluid retention in the body. Normally, ankles and feet maintain proper fluid balance. With liver problems, fluid accumulates, causing visible swelling in these areas. The liver normally produces albumin, a protein that keeps fluid in the bloodstream. When liver function is impaired, less albumin is produced, causing fluid to leak into tissues and accumulate as swelling. Excessive alcohol consumption is one of the most common risk factors for developing liver disease. The liver is responsible for breaking down alcohol in the body, but when consumed in large amounts over time, it can cause serious damage. When you drink alcohol, it enters the bloodstream and goes directly to the liver for processing. Over time, heavy drinking can lead to a buildup of fat in liver cells, a condition called fatty liver disease. If drinking continues, the inflammation can worsen into alcoholic hepatitis, where liver cells become damaged and inflamed. This stage can cause symptoms like jaundice and abdominal pain. The most severe stage is cirrhosis, where healthy liver tissue is replaced by scar tissue. This scarring blocks blood flow and prevents the liver from functioning properly, potentially leading to liver failure or cancer. The good news is that stopping alcohol consumption can help reverse early stages of liver damage, but cirrhosis is often irreversible. Regular moderate drinking is key to liver health. Obesity significantly increases the risk of developing liver diseases. Excess body fat, particularly abdominal fat, can lead to fat accumulation in the liver. A diet high in fat and processed foods contributes by providing excess calories and unhealthy fats that the liver must process. This overload can cause fat to build up in liver cells. Together, these factors can lead to non-alcoholic fatty liver disease, or NAFLD, where excess fat accumulates in liver cells without causing immediate harm. If untreated, NAFLD can progress to non-alcoholic steatohepatitis, or NASH, where the accumulated fat causes inflammation and potential liver damage. Viral hepatitis, particularly hepatitis B and C, poses a significant risk to liver health. These viruses can infect liver cells, causing chronic inflammation that persists over time. Hepatitis B and C viruses enter the body through infected blood or bodily fluids. Once inside, they target liver cells, triggering an immune response that leads to ongoing inflammation and damage. This chronic inflammation can scar the liver tissue, a condition known as cirrhosis. Over time, cirrhosis impairs the liver's ability to function properly. In some cases, chronic viral hepatitis can progress to liver cancer. The damaged liver cells may undergo abnormal changes, leading to malignant tumors. Prevention is crucial. Vaccination against hepatitis B is highly effective and widely available. Regular testing for both hepatitis B and C can lead to early detection and treatment, preventing serious complications. Certain medications, particularly acetaminophen, when taken in high doses, can be toxic to the liver and cause serious damage. Herbal supplements can also be toxic to the liver, potentially leading to liver damage if not used properly. It's crucial to consult a doctor before taking any new medications or supplements to ensure they are safe for your liver health. Family history is another important risk factor for liver diseases. Genetics play a significant role in some liver conditions, with certain diseases having a hereditary component. If close family members have had liver problems, it may indicate an increased genetic predisposition to similar issues. When liver problems develop, certain symptoms serve as important warning signs that require prompt medical attention. The key symptoms to watch for include jaundice, which causes yellowing of the skin and eyes, persistent fatigue that doesn't improve with rest, abdominal pain or discomfort, dark urine that appears unusually colored, pale or clay-colored stool, itchy skin without an obvious cause, and easy bruising or bleeding. If you notice any of these symptoms, especially when they occur together, it's crucial to seek medical evaluation promptly. Don't wait for symptoms to worsen. Early detection can make a significant difference in treatment outcomes. Remember, liver conditions can progress silently, So, paying attention to these warning signs and consulting a healthcare professional is essential for maintaining liver health and preventing serious complications. Blood tests play a crucial role in assessing liver function and detecting potential problems early. Liver enzyme tests measure proteins called ALT and AST that are released when liver cells are damaged. ALT is more specific to the liver, while AST can come from other organs too. Normal ranges are 7 to 56 IU/L for ALT and 10 to 40 IU/L for AST. Elevated levels often indicate liver damage from conditions like hepatitis or fatty liver disease. Bilirubin is a yellow pigment produced when red blood cells break down. The liver processes bilirubin and excretes it in bile. Total bilirubin normal range is 0.3 to 1.2 milligrams per deciliters, while direct bilirubin is normally 0.1 to 0.3 milligrams per deciliters. High bilirubin levels can cause jaundice, turning skin and eyes yellow, and may indicate liver problems like hepatitis or bile duct obstruction. Albumin is a protein made by the liver that helps maintain blood volume and transport substances. Normal serum albumin levels are 3.5 to 5.0 grams per deciliters. Low albumin levels can indicate liver dysfunction, as the liver may not be producing enough of this essential protein. This often occurs in chronic liver diseases like cirrhosis. These blood tests provide valuable information about liver health and help doctors diagnose various liver conditions early. Imaging studies play a crucial role in diagnosing liver conditions by providing detailed pictures of the liver's structure and function. Ultrasound is often the first imaging test used. It uses high-frequency sound waves to create real-time images of the liver, helping doctors spot abnormalities like tumors, cysts, or fluid accumulation. CT scans use X-rays combined with computer technology to produce detailed cross-sectional images of the liver. This helps identify liver damage, cirrhosis, or other conditions. MRI uses strong magnetic fields and radio waves to create highly detailed images of the liver's soft tissues. It's particularly useful for detecting inflammation, tumors, or vascular issues. A healthy diet and regular exercise are crucial for maintaining liver health and managing liver disease. These lifestyle changes can help reduce liver fat, improve function, and prevent further damage. Focus on a diet rich in fruits, vegetables, and whole grains. These foods provide essential nutrients, antioxidants, and fiber that support liver detoxification and reduce inflammation. Regular physical activity, such as brisk walking, cycling, or swimming for at least 30 minutes most days of the week, helps maintain a healthy weight, improves insulin sensitivity, and reduces liver fat accumulation. Limit processed foods high in sodium and additives, sugary drinks that contribute to fatty liver, and saturated fats from red meat and fried foods. These can increase liver inflammation and fat buildup. Incorporating these dietary changes and regular exercise into your lifestyle can significantly improve liver health, prevent disease progression, and enhance overall well-being. Limiting alcohol intake is crucial for maintaining liver health. Alcohol is one of the primary causes of liver damage, contributing to conditions like fatty liver disease, alcoholic hepatitis, and cirrhosis. By reducing or eliminating alcohol consumption, you can significantly lower your risk of developing these serious liver problems. The American Heart Association and other health organizations provide specific guidelines for moderate alcohol consumption. For men, this means no more than 2 drinks per day, while women should limit themselves to 1 drink per day. 1 drink is typically defined as 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of distilled spirits. However, for individuals already diagnosed with liver disease, pregnant women, or those with certain medical conditions, complete abstinence from alcohol is strongly recommended. These groups should avoid alcohol entirely to prevent further liver damage or complications. Remember, these are general guidelines. Always consult your healthcare provider for personalized recommendations based on your specific health situation and medical history. Early detection and treatment of liver problems are crucial for preventing serious complications like cirrhosis, liver failure, and liver cancer. Without early intervention, liver issues can lead to severe outcomes, including cirrhosis, which damages the liver permanently, liver failure, where the organ stops functioning, and even liver cancer. However, early detection and treatment can prevent these serious complications from developing. Regular checkups and screenings are essential. particularly for individuals at high risk due to factors like alcohol consumption, obesity, or family history. Let's recap the 7 hidden signs of liver problems we've covered: persistent fatigue, skin changes like jaundice, abdominal pain and swelling, dark urine, pale stool, itchy skin, and easy bruising or bleeding. Take action for your liver health by being proactive, monitoring your symptoms, and consulting a doctor if you have any concerns. Help raise awareness by sharing this video with others.